what I want to do is actually explain a little bit about why it is I became a chiropractor, my little journey to why it is I do what I do, why I got here, why and how it is that I got into muscle testing. I was actually a pre-med student going off to medical school and was on a journey really to help me uncover some answers to my own sister's health. She was diagnosed with lupus when she was 11. I would have been 21. And they told us from day one that they couldn't determine what caused her lupus, why she had lupus. There was no cure for lupus. But the medications that she would receive as a result of her condition would ultimately take her life before the disease ever did. So me as the older protective brother was not okay with that. I wanted to know what caused her problem, why was she normal till she was 11, and then what made her in one day wake up with the inability to close her hands, move her joints, why did her entire body hurt. I mean, we literally had to carry her down the stairs from her bedroom at 11 years old without any answers. It took 3 hospitals, and we got her down to Scottish Rites Hospital. They were able to determine through biopsies that she had what's called lupus. They diagnosed her with lupus, gave her a bunch of steroid treatments, which she's been on for the last many years. But the reason why I wanted to go to medical school was to answer the questions that we weren't getting for her help. But on that journey, there was a few experiences that took me to chiropractic, and those that took me away from medical school and to chiropractic. That story is on my website. We give that to every patient when they check out after a new exam. We want you to read that there. Once I got into chiropractic school and went up, set up a clinic in Tennessee, within the first year of being in practice, my goal was to always help figure out what caused my sister's lupus, what would make her need prednisone or steroids for the rest of her life. That would ultimately be her demise. And while I was in Tennessee, our third child, whose name's Savannah, she was born right before we had moved to Tennessee. And when she was born 6 weeks early. And I remember still today sitting in the room with Heather when they took her off to NICU, which is the newborn intensive care unit. A doctor comes in about 20 minutes later and he says to us, Mr. and Mrs. Artis, we just want to make you aware that we had to give your daughter a drug, a heart and lung medication, to make her lungs inflate. Her lungs weren't fully developed. And so we had to give her a medication to induce and make her lungs swell with air. In telling you this, we need to make you aware that most children that are born premature and their lungs aren't fully developed typically have asthma for the rest of their life. Now me sitting there and already experiencing what I did with my oldest son, Bryce, which you can read that story online, that took me to chiropractic school, this did not make sense to me whatsoever. How could the doctor tell me that the fact that she was born premature and her lungs weren't fully developed, how would that impose on her for the rest of her life a breathing issue like asthma? Now, remember, she was just born, so we hadn't seen her yet and hadn't actually done a lot with her or seen her grow. But I asked the doctor, why is it that you believe that will happen? And he said, well, because we clinically see that. Most kids that are born early whose lungs aren't fully developed typically have asthma. And I told him, well, my kid won't. I didn't believe that she would. I figured she would grow up. And literally what I thought in my head when he told me that that because she was born premature and her lungs weren't fully developed and that she would have asthma as a result, in my head all I pictured was these little bitty lungs in my little daughter Savannah that weren't going to grow to maturity, and that's why she was going to have asthma. I mean, the excuse was she was born premature, and when she was premature, her lungs weren't fully developed yet. Well, the lungs are going to develop is all I could picture in my head. Of course, she's going to grow. Every child after they're born, they continue to develop. They grow up to adulthood, typically. So I couldn't imagine why it is that if her lungs were smaller than normal or not yet developed, that they wouldn't continue to develop. We all do as we get older, so that didn't really make sense. So I told him, that's not going to happen with my daughter. You know, she'll be fine. Well, we leave the hospital only to find that my daughter, every day for the next 2 years of her life, which includes my time in Tennessee, she wakes up with asthma attacks almost daily. Some asthma attacks would last for 2 weeks. She couldn't breathe. Now, activity didn't change it. Nothing changed her symptoms. It didn't get worse. It didn't get better. So we had a pediatrician there, Dr. Regal, who would actually give us albuterol treatments, nebulizer treatments, all these machines to actually help her breathe, none of which would break up her asthma symptoms. Now, while I was at Parker College of Chiropractic, I also learned how to do acupuncture and was certified to do that. And I could figure out that there were acupuncture points that if I stimulated them, her asthma symptoms would disappear. They would stop. It was just as if an albuterol inhaler would have worked. It would have shut off the symptoms. But we never could figure out what was causing her to go into asthma attacks. So we had tried many things. We tried to alternate the temperature in our home. We tried to use medications, of course. We tried to use a humidifier to help with her asthma symptoms, but nothing would work. The only thing that would stop her asthma was the acupuncture treatments, which were great. But I would consistently send Heather back to Dr. Regal to figure out, our pediatrician, what was causing her asthma. And about on the 6th trip, Dr. Regal says, Heather, to my wife, why do you keep bringing Savannah here? And she said, because she's having another asthma attack and we want to know what it is that we can do to help her. And he said, well, we're already giving you the things that we typically use for asthma. And you've told me before that every time that your husband does acupuncture, all our symptoms go away. So why don't you just do the acupuncture? And she said, you don't understand my husband. He wants you to tell him what's causing her asthma so we can fix it. And he said, well, I'd be a millionaire if I knew what was causing her asthma. No one knows what causes asthma. We don't know. We know she was born premature, and most preemies have asthma the rest of their life, which didn't really sit well with me. So we stopped going to the pediatrician using the nebulizers because they really didn't change anything. I knew I could stop it with acupuncture. But ideally, I wanted someone to be able to fix my daughter and tell me what was going on and causing her symptoms. So we ended up in Florida at a clinic, and a doctor there assessed my daughter, evaluated her, similar to what we do in our office now. And he was able to determine that her heart was stressed. No other organ in her body was stressed but the heart, not the lungs, which you would assume to find with asthma. It was the heart. Then they used test kits like we do in our office to determine what was causing the stress on her heart. And they found that a medication that she was being given had stressed her heart to the point where it had most likely paralyzed a part of her heart muscle, made it hard for her heart to actually pump enough blood into the lungs to get oxygenated, and most likely would lead to her asthma symptoms, which was very interesting to me because when they did the evaluation, I didn't actually tell them what was wrong with her. They actually were able to figure this out. They said, your daughter most likely has breathing issues because of the stress on her heart. And I said, how did you know she had breathing problems? And they said, because every child that we see who has heart stress commonly has recurrent bronchitis, pneumonia, or asthma. She does have breathing issues, right? Which was true. And finding that a medication was there, they started quizzing me. Well, what medications are you giving her? And I said, well, I'm a chiropractor. I don't give her any medications. And he proceeded to tell me, he said, don't badger me. You gave her a medication, or she's been given a medication that would have created stress on her heart. Now, logically, you have to think about, when did her asthma symptoms start? Because if it was the medication that stressed her heart, it started early on, because from the day one when we got her home, she was having asthma attacks from then on. There was only one medication that had been administered to her in the hospital. We don't vaccinate our kids, so she didn't even receive any vaccinations. It was that one drug that they had told us that when that doctor came in and said, Mr. and Mrs. Artis, we just have to let you know, we had to administer your daughter with a heart and lung medication to force the heart to pump more blood into the lungs. It was that drug that had a side effect that actually damaged a part of her heart muscle to give her asthma. This is what was creating the weakness. And so at this point, I'm thinking, okay, so I explained to him what had happened to Savannah, and he says, well, just so you know, there is a solution. There is a nutritional supplement that she's testing for. This supplement has vitamin B properties in it, vitamin B complexes. It's got other substances in there that will actually help heal the heart. She needs to take this just one a day is what she was testing for. Now, my daughter was 2 at this time. She only needs to take one of these, and when she takes the one, you'll see that all of her symptoms will go away. But you, Mr. Artis, you need to learn how to do this testing technique so you can determine when to take her off of it. Now, I'm going to share the story because a lot of patients come in with all the same answers. Why do I need these products? How long do I need to take them for? And so this story answers them. What ages of children can you treat? Or people, how old or young are they? Well, my daughter was 2, so that's pretty young, and we see all ranges or ages. But after giving my daughter the first dose of Cardio Plus, she honestly never had another episode of asthma from that day. Now, after watching this for 2 months and her not having another asthma attack, or me having to use albuterol or nebulizers or acupuncture, I wanted to know after 2 months how it is the doctor could assess so specifically what was causing the condition that my daughter was struggling with. So I went down to Florida, set up for a year there, did training to learn how to do this muscle testing technique that gives us this information that we help our patients with now in the office. So my daughter was taking this supplement while I was going through our training. After 2 months, I wanted to know what was going on and how to learn this stuff, so I was getting trained in it. And every month I would evaluate my daughter to see, do you still need this product? And after a year, she stopped testing for it. Now all of her symptoms were gone from the first day we gave it to her. So it almost looks like it fixed it right away. But actually, it took time to actually repair the heart muscle itself. So she actually was testing for this product and had to take it for a full year until she was 3 years old, which is a little bit different than taking an asthma medication for the rest of your life. She only tested for this for a year. At the end of that year, she is now 6 years old. It's been 3 years entirely since she's had to take a Cardio Plus supplement, period, at all for her heart. She's never once ever had a wheeze, a cough, an asthma attack, no nothing. Now for me, this is amazing because my daughter, I now know, will never have to suffer or worry about having asthma. I mean, how many teenagers do you see now, or adolescents or adults even, that are restricted to activity because of their fear of having an asthma attack, right? They can't go hiking, they can't join the cross-country team, they can't play basketball, they can't do whatever cheerleading, gymnastics, because they worry about this fear of having an asthma attack and dying. I mean, that's the fear, that they're not going to be able to breathe. And I know my daughter will never have those concerns. She'll never even remember. I mean, she was 2 years old. Not much of us remember things before we were 2. But for me, it motivates me to help other people. It makes me think about all the kids that are struggling with asthma for unknown reasons, what's creating that stress. Now, this story doesn't mean that every child has asthma because, or every adult has asthma because they have a medication that stressed their heart. It could be anything. It could be anything that was creating stress on their heart, their lungs, their immune system. It could be allergy or sinus related. It could be anything. So that's the great thing about the testing technique, is that it allows us to figure out specifically for them what's causing their concerns or their symptoms. But it frees up the individual's quality of life if you can give them the answers to the questions, which is, why am I sick? Why do I live with this condition? There is a reason. It's not a lack of a medication that's going to correct the problem. That's not why you have the condition. My daughter did not have asthma because she needed albuterol. There was a problem, and it was a medication that was stressing her heart from the day she was born. It only took once, and that damage was enough to not allow her heart to heal anymore. And whether or not that medication was still in the heart, it wasn't important. When we fixed the heart and healed the heart muscle itself, none of those symptoms ever returned. And this is very similar to what we see with every patient that comes in. But that is what got me into muscle testing. So immediately upon seeing this with my own daughter, we've taken this to thousands of patients ever since. And it doesn't matter what the condition is. It can be cancer, it can be diabetes, Crohn's disease, ulcerative colitis. It doesn't matter, fibromyalgia, lupus, rheumatoid arthritis, all of these conditions. There's always a cause for your problem. Just because your medical doctor tells you that it's unknown, we don't know what causes it, there is no cure, it doesn't mean there's not an answer. They're telling you they don't know what the problem is. And for me, there's an analogy I like to use with patients. If you have a car, for example, and this car you bought brand new and you understand everything about how it runs, you know, how it runs, the quality of the drive, how it drives. If all of a sudden something changes in that car, let's say you hear a rattle or something, and you take that car to a mechanic, and that mechanic overlooks your car and tells you, you know what, Mr. Artis, this car's 4 or 5 years old, it's a Toyota, this is just how they break down. They all eventually develop what's called rattleitis, right? So we don't know what causes it, we don't know how to fix it, but we're going to charge you money for this evaluation, and then we're going to give you some earplugs so you don't hear it anymore. If you put your earplugs in, you won't hear the rattle or the noise anymore. Your quality of drive will be improved. You won't be bothered anymore or annoyed by that sound or that symptom. No one would ever, I don't think, return back to that mechanic or take their car back to that mechanic who could not tell them what was actually causing their problem, and then have a solution for it. Same thing for me. I am always determined to want to uncover what is the root cause of your concerns or your health problems. There is always a reason. And it's not just we don't know and there's not a cure. There's usually something pretty simple. Usually people are thinking it's got to be real complex. Like if you remember the daughter I just told you about, the story I told you about my daughter, it was one product, one supplement that corrected the problem. It wasn't and it was a vitamin B complex. It wasn't some amazing new drug that we were waiting to be developed. It wasn't some array of therapies or transplants or surgeries. It was one little supplement that took care of all the problems. And in most cases when patients come in, it's really that. It's really one simple thing. We handle it, watch the body improve. Another thing you learn about from the story is the body does not heal overnight. It takes time. The body does not heal overnight. We always want it to. We want it to be better tomorrow. But that's not how it works. The body heals over time. Just like with my daughter. She was only 2, had stress in her heart for 2 years, but it took a full year to actually get the heart to function and repair those tissues of the heart to repair to where it was functioning normally and at a capacity where she would never have another symptom again. And we expect that she won't, which is going to be great. But that's a story I like to tell to actually get the point across that the body does get better. What kind of time frame is it going to take for all of our patients to heal? We have no idea. How old are they? How much stress have they been under? How many medications are they on? What other therapies have they tried? You know, what's their diet like? There's a lot of factors that go into that. So that's a part of what's fun about doing this testing with patients is every single patient is unique. They're individual. And it's fun to treat them that way. And so it makes it fun for me. The challenge is for me, let's find out what's causing you the stress and then let's watch the body get better. And if you feed it, the body gets better. The body has 3 primary things that it lives off of. This is a living, breathing organism. 3 things that it's required to survive. Air, water, and food. From the time you were born, you need air, you need water, you need food. If you don't have any of one of those things, we all die. It's truly the quality of the air, quality of the water, quality of the food that dictates how well and how healthy this body is. That's why we like to look at what is it that you're putting into your body to help the body repair and heal. And the body will heal if you give it what it needs. The body never truly was born with an inherent need for a chemical or a medication to heal it. Medications in and of themselves don't heal, unfortunately. They are great and should be used for short-term use and emergency use, but never for long-term. They don't correct the underlying problem, but food, water, and air will. They will actually help the body heal. So that's how we direct patients in our office, through diet. I didn't have to do a lot of that with Savannah. It was really just a supplement. She needed just B complexes. But we go through diet, we go through emotional history, we go through trauma history, we go through medication history, therapies they've used before and after, and then we put together a program or a protocol that'll help them. Very similar to what we did with Savannah. We want you guys to get the same results. That's really what we're looking for. We want to help people uncover the root causes of their illnesses. And we have people that come from all over the world. We've had patients from France, Brazil, Canada. They come from everywhere. If someone can give them an answer to the questions of why, they will come. If we can give them those answers, then we know they're well on their way to health.